5 years after COVID, doctors are still burnt out, and it could be affecting their patients as well. According to a poll from July, more than half of physicians say they're feeling the effects of burnout. That is down from a 2021 high of 63% in the middle of a huge wave of COVID-19 cases across the country. The pandemic exacerbated an already existing burnout issue among doctors, many forced to work long hours under highly stressful and uncertain conditions with equipment shortages and isolation protocols. So with that came increased awareness about the mental health toll that doctors and nurses were experiencing. Congress even passed a law in 2022 that created federal grants aimed at reducing and preventing burnout for health providers. But doctors say that that isn't the root problem. They say there are simply too few people doing too much work. Systemic changes in the industry have created excess administrative tasks like filing insurance claims. Payment structures have also changed, including decreasing Medicare payment rates, making it more difficult to maintain and operate a practice in today's day and age. These issues do need to be solved to keep patients safe as well. One study linked doctor burnout with 2 times more risk for patients.
You can see the linkage there. They're trying to figure out ways to help with this. Notably, Jill, the healthcare industry is projected to add the highest number of jobs of any industry in the U.S. over the next decade. Medical school enrollment is also at the highest ever. 100,000 students currently attending medical school despite these headlines. And it sort of reminds me, as we talk today, 5 years since COVID, remember the brief period in the spring of 2020 when we were cheering on our doctors?
7 p.m.
We would clank our pots and pans in the windows in New York City, at least. Let's bring that back. Though even the doctors would probably say, can you do more than clanking pots and pans?
For us right now. Thank you. Yeah.
A thank you. I should note, actually, my wife, Alex, posted on her Instagram account. And this is like why I love her. Well, I love her for many reasons, but she's extremely thoughtful. And recently, during a visit to our pediatrician with her daughter, she asked the pediatrician like what her hobby was. She could tell she was stressed. And the doctor said, I like sushi making. Like, that's fun for me. So Alex actually went and bought like a sushi making kit for her. And actually over the weekend, we got a note from the doctor saying, my family very much enjoyed our attempt at sushi making, using the, various things you got me. And so, have to say, not saying you should get a sushi making kit for your doctor, but maybe, as your doctor, how they're doing, is probably the first step to at least make their day slightly better with all that's going on.